In this operating room at Spartanburg Regional Hospital, doctors are using highly advanced technology to help diagnose lung cancer. This minimally invasive option is called EBUS, or endobronchial ultrasound. It's helping surgeons determine if a patient can avoid surgery by giving them a much more clear view of a patient's lymph nodes, which can indicate the presence of cancer. And it's the future of lung cancer diagnosis.
Well, anytime we're looking at the lymph nodes, they're drainage basins for the lungs, okay? And oftentimes we're using EBUS in order to evaluate whether these lymph nodes are involved with lung cancer. It can also be used for benign disease, but most of the time it's for lung cancer.
The EBUS procedure is done under general anesthesia, allowing doctors to enter the airway and get to the lymph nodes without making a single incision.
In the past, we've been biopsying these lymph nodes through a procedure called mediastinoscopy. This is through a small incision at the base of the neck in which we have to go on top of the airway in order to identify and biopsy these lymph nodes. So EBUS allows us to biopsy these lymph nodes with a needle in a minimally invasive fashion and many times avoid a surgical procedure for the patient.
Lung cancer cells can spread through the lymphatic system and are carried to lymph nodes where they can lodge and grow. Determining if and what lymph nodes the cancer has spread to is important so that doctors can choose the best possible treatment.
And what it allows us to do is to be passed through the airways, and then we evaluate lymph nodes that sit just beyond the airways that normally can't be visualized. And this scope on the end of it has a small ultrasound, and that's what gives us the visualization. It has a working port that allows us to do needle biopsies, which is minimally invasive for the patient.
The EBUS procedure is fast and diagnosis is immediate.
Once we have the lymph node under direct ultrasound visualization, I'll pass a needle into that lymph node, and under direct visualization it allows us to extract cells from that lymph node. Those cells are then placed on a slide and sent directly to the pathologist, and they'll immediately assess it and evaluate whether there's any malignancy involved in that lymph node.
State-of-the-art cancer diagnosis at Spartanburg Regional Healthcare System, raising the standard of healthcare in the region.